Hello folks, how are you my friends? This is Dr. Arroyo from My Health Consultants, and we're going to talk about something we get questions about all the time, which is what do you do when we go there to evaluate our candidates to see if I am a candidate for corneal molding. As a very quick refresher, corneal molding is a non-surgical vision correction modality which is reversible, which is obviously non-surgical, and it serves the purpose of liberating the patient from wearing glasses or contacts or daytime contacts all day long. This is done non-invasively, and it works very, very well on many people. It doesn't work on everyone, and this is the main reason why we bring the patient in to know for sure if you are a good candidate for corneal molding. Some patients will ask us online, on Facebook, over the phone, well, am I a candidate? Here's my prescription. Unfortunately, it's a little bit more complicated than that. But the exam starts by collecting a fairly complete history or medical history or eye history. We want to know if the patient had any prior history of surgery, prior eye traumas, prior eye conditions, drops, medications, etc. After that, we measure the refractive status of the eye. Refractive status means whether you are nearsighted, whether you are farsighted, you need glasses for near, for distance, etc. And for that, we use this technology called autorefractor, which is a computer that measures the refractive status. It tells us pretty accurately many times whether the patient needs glasses or not, and if they need glasses, whether they are farsighted or nearsighted or astigmat or whatever else they are. So after we collect this information, we bring the patient to another room. And remember, this is an exam to evaluate candidacy for, or you're a candidate for corneal molding. So after we've done that, then we are going to take something called a topography. And we capture an image of the corneal curvature. And that's very important because that corneal curvature is going to tell us whether the patient has good corneas that can be molded non-surgically. So that's what we're going to do now. There are different types of corneal topographies. We've had 3 different ones over time. We like the portable type because it's obviously more convenient for the patient. All right. So what we're doing now is to capture 15,000 points of data from the corneal surface of the eye. What we're seeing as we're flattening the central part of the cornea. This is a myope patient or nearsighted individual that needed a modification of the corneal shape in such a fashion that the central portion is actually flatter. Again, we take a history, we want to know about the patient's eyes, we take a refractive status of the eye, we check the visual acuities of course, we check their glasses to see what they're actually wearing. If they wear contacts, we want to know what contacts they're wearing, for how long. We measure, obviously, clearly we need to know if the corneas are healthy. And for that, very importantly, we need to take a blueprint of the cornea that gives us information about the topographic map of curvatures in 3D actually, because that information we're going to use to elaborate the custom mold that will actually reshape the cornea while you sleep. So that's it folks. I hope this clarifies some of the questions for you. If you have any more questions, please keep them coming. Write us a question on Facebook, give us a call. We're here for you. We thank you very much for your support. We thank you for being our friends, and we look forward to having you soon. Stay dry and see you next time. Thank you guys.